are we operating most efficiently and optimally? I would say, I would tell my colleagues that they should think more like it was COVID again. What do I mean by that? I think a lot of my colleagues, what I noticed is that they sort of post-pandemic went running back to doing business as usual. What do I mean by that? They're not doing enough telehealth. Telehealth is a win-win for the health center and for our patients. It's cheaper and incredibly, efficient for patients, and they love it. So North Shore is a market leader. We'd still do about 30 to 40% of our medical visits are telehealth, whether it's video or phone, and probably upwards of 70% of our behavioral health visits are done telehealth. That's really, really efficient. It's great for the patients. It's great for the providers. It's also, if you look around at all these startups that are popping up all over the place, they're all telehealth. There's a reason why there's all this money going into telehealth. It would behoove my colleagues from across the country to really take another hard look at this and get in on it and build that capacity. It's very efficient and patients really like it. So, if you're not doing that, and, we just had you all know this, we had 2 big weather events here in the last 2 weeks, right? We didn't actually have to close. We had to close our dental practice because you still can't do dentistry via telehealth, but we could still do primary care visits and behavioral health visits. And we did. So, we didn't see a huge impact to our revenue on those days that we ended up having to close. So again, it's like trying to think a little bit more creatively. Business as usual is not going to continue to work anymore. It just isn't.